Many patients ask me a very common doubt, which is, what should I do when I have fever? Should I immediately consult a doctor, or can I wait for few days and then decide on consulting a doctor? As you know, medical consultation goes with it expenditure in the form of fees to the doctor, expenditure for the test you do, and also the medications which is prescribed. So when can you wait and watch before deciding to going to the doctor? Now, if you do not have any major organ diseases, like if you have a major cardiac problem like heart failure, or a respiratory problem like difficulty in breathing and you are taking some inhalers regularly, or you have a liver problem, or you have a kidney problem, or you have a brain problem like Parkinson's disease, then you need to seek medical attention as early as possible. But if you are otherwise healthy, it's okay if you have diabetes or hypertension or increased cholesterol or well-controlled bronchial asthma. So if you are otherwise healthy, or you have minor medical illness which is well controlled with therapy, then you can wait for few days. So what is that you should be on the lookout when you wait during this initial period of fever? First thing is, your diet intake and water intake or liquid intake is very important. So during fever, sometimes we may not feel like having our regular food like idli or dosa or roti or rice. It's okay, but you should take at least fruits in the form of solid fruits or liquids. So intake of liquids is very essential because it keeps your immunity at a correct pace to match with the infecting organism. So the common infections are viruses like dengue fever or influenza virus, bacteria like typhoid bacteria, or parasites like the malaria. But in general, 2 out of 3 fevers in people who are otherwise healthy are due to viruses, for which there is no specific treatment. And most of this virus fever goes off in about 3 to 4 days. So all you need to do for this virus fever is to just have your body well nourished with liquids. So you have to take liquids in any form. It can be water, but taking water alone may be difficult during fever because of the bitter taste sometimes. So you can take it in the form of juice like tender coconut or apple juice or citrus fruits, and you can take porridge like rice porridge or porridge made of barley, or milk with some amount of protein powder along with that. So in any form you have to take liquids. So don't starve yourself because fever will be high, you may have headache. So don't keep on just lying on the bed and taking this paracetamol for your fever and pass your day along. Never do that. So for a 50 kg individual who has a normal heart function and a kidney function, you need around at least 1500 to 2000 liquids per day. So drink liquids in the first day even if you are having difficulty. But if you are not able to take any liquids due to vomiting or pain in the abdomen, and you have not managed, you have tried but you have not managed, but then you need to seek medical attention to give some medicine to suppress your vomiting, or if it is difficult you may need some additional intravenous fluids therapy if you are not able to take adequate water at all. Why I am concentrating on this water intake or liquid intake is because when you hydrate adequately only, the blood supply to all the tissues will be good. So the blood supply, the circulating blood to the tissues are important because the immunity depends on that. So if you are not taking adequate hydration, then you are putting all the organs at risk and you may land up in a bigger problem. So how long can I hydrate like this and wait? So as I told you, most viral fevers are self-contained in the period of about 3 to 4 days. So by 48 hours, by 2 days, there should be some signs of improvement. Like you should be able to take orally more comfortably. Your other symptoms like tiredness should slightly improve. So if beyond the third day, fever is persisting and your symptoms are not improving, then medical intervention is required. So the message I want to convey through this video is that, so when if you are otherwise a healthy individual, hydration is the first main goal you should have when you have fever. Keep documenting the fever, and virus may have very high fever of 102, 101, but it will come down with supportive paracetamol alone. If it is not coming down with paracetamol, what should I do? So one thing what you can do is what is called the historical way of bringing out the temperature, which is technically called evaporative cooling. So how it is done is, you just wear just an undergarment and then ask your closest relative or helper to give a sponging, just ordinary tap water in a dry cotton cloth. It should be just swiped all through your body from the front part, from up to your hip and then below both the legs, and then leave it to cool for about 10 minutes. Then you turn and lie down with the back facing upward. Ask them to do fully in the back direction and allow it to cool about 10 minutes. So this will bring down temperature which is as high as even 104 degree Fahrenheit. So high fever in the first 1 or 2 days in an otherwise healthy individual is not an alarm sign at all, because you get it very commonly in viral illnesses like dengue.